The honourable member for Dartmouth North.
Mr. Speaker, my question is for the Premier. Earlier this week, in an exchange about the ballooning numbers of people on the Family Doctor Registry, the Premier said that being on the list does not mean you don't have access to care. But this is not entirely true. As my colleague has already outlined, more and more people are logging into the virtual care platform in the morning to see that they can't get in unless they pay a fee. Mr. Speaker, does the Premier think it is okay that Nova Scotians are being forced to pay fees for their health care because they can't get appointments at walk-ins or on the public virtual care platform?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. I'd like to thank the member opposite for the question. So, of course, we want to make sure virtual care is there and it's free to people because we want them to have access, especially as they're waiting for a primary care team in order to look after them. So we are constantly looking at onboarding and expanding clinicians, not only physicians but nurse practitioners who can work in virtual care in Nova Scotia. We're also looking at recruitment and retention. We spoke a little bit about it yesterday. It's really an important part. We're working, I had a meeting today about how we can streamline bringing healthcare professionals into this province and use them to the highest ability of their scope. So there's a lot of work to do. We continue to look at options, and I can guarantee that this conversation will be ongoing as we continue to improve healthcare.
The honourable member for Dartmouth North.
Mr. Speaker, Nova Scotians need primary care. We all know that. As many as 1 in 4 don't have access to a regular health care provider. Stephen from Mill Village contacted us to say, because I could not get a timely doctor's appointment and emergency was filled beyond the brim, I spent $75 on a prescription from Maple Medical in Ontario. Had I been unable to do that, I would have ended up with bronchial pneumonia. Mr. Speaker, will the Premier tell Stephen how long he will have to wait for in-person primary care?
The Honourable Minister of Health and Wellness.
So our emergency services are always available to people in terms of going if they have any difficulty breathing or anything like that. People should always present to the emergency room or call 911 if they have any sort of emergency treatment. When people access virtual care, providers actually do an assessment over the phone and will refer people to primary care clinics throughout the province if they feel that an inpatient appointment is necessary. We know that there are gaps and that there are long wait lists, but we continue to recruit and we continue to build teams around our primary care providers to ensure that people not only get physician and nurse practitioner, but they also have the care of the team. And Dow Family Medicine is a prime example of how we've expanded that and will continue to do so. Thank you.